Well, welcome everybody to this Friday session on occupational health and safety, risk management, and anything else that is on the top of your mind today. We're aware that this is a very difficult period to be working with. We find that moving from the phase in March where we closed everything down very quickly was quite simple, wasn't it? It was, we can say everything stops. But now going through a gradual process of transition where we bring people back into our buildings and start new ways of operating, it's much more complex, more difficult to navigate. And that's why we're obviously seeing a lot of interest in how we explore these issues today. So today we have with us Elnura, and Elnura is going to introduce herself, talk about her work and the crisis team at the Synod and some of the principles that we are needing to think about. I've told her about some of the questions we have and she'll be able to address some of those, but we'll have more questions today, I'm sure, that we haven't heard about. So I'm just going to hand over to Elnura to introduce herself now.
Hello?
Yes, go.
Yeah, can you hear me?
Yeah, that's great.
Okay. Hi, everyone. I'm Elnura, and I'm the new Health and Safety Officer for Synod. I'm also part of the crisis management team now, and I can answer any health and safety questions that you might
have. Okay. Tell us about what does your work involve mostly? What are you?
Well, at the moment, I am concentrating on changing the auditing process for the congregations, risk assessment and mitigation. I'm also working on contractor management at the moment, trying to make some changes to make it easier for everyone.
Yeah.
On how we engage and manage contractors.
Okay, so that's about contractors. That's great. And tell us about the crisis management team. What are they doing? When are they meeting?
Well, I'm new to the team, but they're meeting twice a week at the moment, and they're trying to cover all the COVID issues and questions for congregations and the wider church.
Okay. So, and they're the group that are putting out the frequently asked question documents and so on.
Yes, putting together that. And also at the moment, I am working on an action plan for congregations for reopening to the public.
Okay. And what does an action plan look like?
I believe it should come out on Tuesday, hopefully. Let me just have a look. So the action plan will have different categories like access to the building and different items that need to be covered up. It will be in the form of a checklist. Talks about visitor screening, hygiene, physical distancing, and everything the congregations would, recommended actions for congregations to put in place before they open up a church.
Yeah. So how about talking us through what you're looking at putting in that list at the moment and give us a heads up on what's coming. Obviously, some of those have already been talked about.
They have been, but I've had some feedback from different presbyteries saying that it is not easy for congregations to understand what was already released in the e-news. So I'm trying to come up with a more simple checklist. It will talk about access to building, seating arrangements, public areas, visitors and contractors, meeting rooms, kitchens, and how to respond to a suspected COVID case, as well as cleaning.
Right.
Yeah.
Well, that's what we're all interested in today.
Okay.
So how about we talk about access to the building? What are the kinds of things that congregations need to think about?
Okay. Sorry, just give me a second. I'm not sure. Sorry, I've lost it. So access to building would be, first of all, visitor screening. We thought about asking visitors to complete a form, but that might not be the best thing, touching pens and filling out forms. So instead, it might be easier to put up a poster. Do not enter if you have any symptoms, something like that. So I'm going, in the document, I'm going to link all the posters and all the procedures. Thinking about hygiene, thinking about physical distancing, limiting the number of people to current state guidelines. Yeah, having hand sanitizer on the entry and exit points. Considering maybe installing a touch-free automatic dispensers, things like that. Keeping a visitor log, a record with people's names and phone numbers, dates and times in which the person attended the premises. And this is mainly for the DHS to be able to trace back any outbreaks.
All right. So one of the questions that we've had from congregations is, what if we have rental groups who are in our buildings? Do we need to be there to take these details, or can we ask the rental group to look after the register while they are bringing people into the building?
Okay, so with rental, I don't see why we would have to do it as long as they're keeping a register.
Okay, so what at what point would they need to be sharing that register with anybody? Is it if there's a suspected outbreak?
That's right.
Yeah, so what would happen then?
What would happen is we would need to report the incident to the Department of Health and Human Services, and they would take it from there.
Okay.
And we would do all our cleaning procedures.
Right. So the likes of, let's say, Alcoholics Anonymous or Gamblers Anonymous, they can have their own records and ensure that they are kept well.
Yeah,
Right?
that's correct.
Okay. Whereas the congregation would need to have its register for people coming for its own purposes. Yeah.
Yep. But just one thing with rentals, I guess it depends. If a property is under lease, then it would be up to them to put in place their own controls. But if someone is sharing the space with us, then it would be same as any contractor, I guess. What we have in place for contractors could be applied to these groups of people.
So what do we have in place for contractors? Tell us about how that works.
Well, I'm trying to make some changes to that at the moment, but look, at the end of the day, we are responsible for our own environment, and tenants must follow our procedures when they're on our premises.
Right.
Yeah.
So we have to be clear about the guidelines that we have for ourselves that they need to follow as well.
That's correct. That would be part of the induction, contractor induction that we do on our sites.
Okay, so we're responsible for an induction, an orientation to all our rental groups as well as contractors.
Yes.
And that induction would follow through the procedures, and then they would sign a document saying that they understand what's going on.
They're aware of all the risks. Yeah.
Yes.
Yeah.
Mm-hmm. Okay. And we've had people asking, so how would we know that our rental groups or contractors are actually following through? Do we need to do checks, or do we ask them to?
I guess we can never be 100% sure, but random checks, yes, yeah.
Sure. And one other thought was having a checklist for each time the group's using the hall to actually say, tick, 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 I've done all those things and signed off.
Yeah, that's correct. And I can work on this.
Yeah,
well.
that'd be great. It'd be great to have that kind of a checklist. Now, Ray's just asked, who coming down to cleaning, which is, I think, last on your list, but we'll jump there. Who is responsible for deep cleaning? So there's cleaning after some events, but deep cleaning, which is what we have some responsibility for. How would that work?
Okay, well, that depends on the congregation and the arrangements they have. I'm not sure if every congregation has a cleaner. If not, then they would have to allocate a person or engage a cleaner.
I noticed Kelly just asked a question about contractors and renters. So the difference between a contractor and a renter, I mean, there are two different things, but the same principles might apply. So a contractor is a person who's coming onto our premises to do particular work. Is that right?
That's correct.
And we have a responsibility for an induction of those people.
Yes.
Outlining the risks on our property and what they need to do to follow our procedures.
Yes.
And they sign off on that when they come onto our site. And
they
obviously,
are responsible and after that, they need to do their own risk assessment and mitigate the risk.
Right.
Yeah.
Okay. So that's a legal issue, and it's a risk management issue for us as congregations. And I suspect that not all our congregations have actually thought much about that still. It's still a learning curve for us, and you're doing some work on that.
I am trying to come up with a way to make it easier for everyone. Like the current online induction, I don't think it is that great. So hopefully in the next month or two, I can talk more about it.
Yeah, that's great. So then the same principle applies for not just people coming to work on our sites, but also the groups that come to rent our rooms or our buildings. The same principle about responsibility for risk management.
Yeah, definitely.
Yeah, that's helpful.
Sorry, I'm just a little bit nervous. I haven't never been in a meeting with this many people.
Just yeah, don't worry about that. The next thing is seating. Now, you talked about seating as part of the plan, and that would apply to people coming to sit in a congregation for worship, but also apply to people coming to sit in a meeting, let's say one of those AA groups. What's the crisis group thinking about in terms of seating?
In terms of seating, we're talking about physical distancing, mainly ensuring that people are sitting the appropriate distances apart, which is 1.5 meters, and that includes both sides, side to side and back to front. And thinking about like multiple services, considering using alternative seating configuration, maybe example like use left side and then the right side.
Okay.
And doing the cleaning in between.
Right. And that was a big question that the likes of Noble Park, who have quite a number of congregations who use their property when everything's going full swing. So they might have a Sudanese group or a Spanish group and so on. And their comment was, well, look, up to now it's been one group leaves, another group arrives. What are we going to have to think about in terms of, do we have to clean between those groups?
Yes, clean between the groups and if possible, leave an hour in between the services.
Okay, which may mean that some of those congregations will have to shorten their services.
Yeah.
Which in fact, shortening a service also reduces risk, doesn't it?
That's correct. And I'm not sure how the congregations would manage like the number of people,
okay.
how they would turn away some people.
That's right. So at the moment, the limit is 20 people.
Yeah.
And that's likely to go up to, let's say, 50 at some point.
Yes.
And then maybe 100.
Yeah.
I see you've got posters available for us for those times when we're able to have those numbers.
Yes.
Right.
But,
So, and then maybe at some point, the limits might be reduced altogether, taken away altogether. At some point.
Yes, at some point, hopefully soon.
Yes. Okay. All right. So at the moment,
I guess it would be up to the congregation to manage that. Like at the moment, the restaurants have reopened and they have a limit, so they're taking bookings and.
Yes. Okay. Yeah. So yeah, some groups are saying yes, a bit like a restaurant. You actually have to pre-book to come into the worship service.
I'm not sure how that would work for a church. That's
Well, I'm pretty sure Mount Martha are thinking about that.
Okay.
Where they're having 2 services or 3 services, and people actually have to sign up.
Yeah.
And that's partly why the government regulations for Victoria talk about it being a private worship service, not just anybody can turn up. Yes.
Yeah.
Mm-hmm. So we need to know who's there. What do we need to know about them?
So what we need to is their first name, their phone number, date and time at which the person attended our premises. That's pretty much it, and we keep it for 28 days.
For 28 days, okay.
Yeah.
And then, someone's asking, Belinda's asking about activities and toys for children. Have we got any thoughts about keeping a space safe for children? Because we have toys that are left out. Do we limit the kinds of toys we put out? Do we? I know that some congregations have decided that they are removing soft toys.
Okay.
And putting in only toys that can be kept clean or cleaned easily between sessions.
Okay. Yeah.
Or keeping different sets of toys for different groups, so that there's no cross between congregations. And Peter Byrne says it would be great to have some clarification around the issue of children. If we could get some follow-up from the DHHS, that would be really helpful.
Okay, well then.
It's actually a frequently asked question today in our session.
Okay.
Okay. How about kitchens, food and drink? Are there thoughts about
kitchens? Okay. So with kitchens, I would think about whether, consider the implications of opening up a church kitchen due to the extensive cleaning and sanitization requirements, but we still have to put the same things in place, like physical distancing, making sure signs for maximum capacity, and hygiene, keeping a log of who's been in the kitchen. We can't share crockery utensils. Yeah, that's
okay. So this
congregation
comes down to risk management there, isn't it, really?
That's right.
Principles of identifying the risk and working out what's going on in the kitchen and how we might actually ensure that it's a safe space, or decide not to use the kitchen at all.
That would be best, in my opinion. Yeah, and keeping a log of cleaning and sanitization of the kitchen as well.
Yes. I still remember.
It would be a lot of work.
That's true. We had a big service at Leemore just for an ordination, and we tried to say to people, spread yourselves out so you're not too close, but that room was packed.
Yeah.
And when I went to get myself a coffee, someone poured a coffee for me and handed it to me, and I thought that wasn't meant to happen.
Yeah.
So it's very difficult to manage that risk. So that's why some congregations, if they go back or when they go back, would probably avoid having a morning tea afterwards.
Yeah.
Okay, that's helpful. You mentioned suspected cases of COVID-19. And so we're responsible as congregations to keep our eye out for that. Is that true?
Yes, if a person is found to be showing symptoms of an infection, like shortness of breath and all the other symptoms. I'm not sure if every congregation has a first aider. So we would. I've got a step-by-step instruction on what to do, and the main the main thing would be general droplet and contact precautions. In any situation, people think they might be at risk of exposure.
Okay, so that's first of all keeping people safe medically. But do you think it would be helpful if we have one person to actually have an eye on that side of things?
Yes.
Okay.
It would. So in this, the checklist that I'm talking about, there is a column where you can put persons responsible for each item.
Okay. So that would apply to tenants as well as to the congregation, wouldn't it? So if we
yes.
let's say we have children's acrobatics coming to meet in the hall in July, let's say, we'd have to say that to them, you'll have responsibility for monitoring the health of your members or your clients.
Yes.
Okay.
Just like contractors.
Yes, just like contractors. Okay. Yeah. So the same thing applies to us and to our tenants.
So it would be simple steps: isolating the person from others and referring them to a medical practitioner.
Right.
Providing a disposable surgical mask if it's available, and asking them to wear it as a measure before they leave.
Okay.
Yeah, making arrangements for their safe transportation to home or to a doctor. Keeping a record of people reporting to be ill, and then I'm not sure. Is it the minister that incidents are reported to, and any confirmed cases they can report to me?
Well, I wonder, most of our congregations have a safe church contact person, and often we've just thought about safety of children or vulnerable people, but in this case, the same principles apply, don't they? So it would make sense for us to ensure that we do have a safe church contact person, and that person's well briefed around this issue. Yeah, that'd be great. And the Presbytery has and the Synod, we have the same database around who are the safe church contact people for our congregations. So the question is, do we have to report that to anyone if we think that someone may be showing symptoms of COVID-19?
To the contact person or the minister. However, if there is a confirmed case, I would still go and complete the incident report and send it through to myself. Synod.
Okay. All right. So there's an incident report form that we should have?
Yeah, that's on the intranet online that can be downloaded.
Okay.
Yeah.
All right. Well, and we'll make sure that people have a copy of that.
Yeah.
Yes. So here's a question, coming back to deep cleaning. Can you talk us through, I mean, look, it's been really helpful so far. Can you talk about what's involved with deep cleaning? What are the kinds of things? And we've had people asking, so what do we clean? Do we clean everything? Do we, is it particular surfaces?
Okay, so the best way to go would be the Department of Health and Human Services guidelines, which I can also send through to everyone. There are items that need to be cleaned weekly, some daily, some after each use. So
okay, so it's not one size fits all. There's actually some things have to be cleaned
weekly,
deep cleaning weekly, and then other things
Daily.
Yeah.
Yeah.
Okay.
Um,
One question was, if there's been no one in the building for 3 months, do we have to do a deep clean before we have the funeral next week?
that would be a good idea. You don't necessarily need to do a deep clean, but just a general clean.
Okay. Right. Yep. So what makes a deep clean deep? What is it different to something else?
Not really. It would be cleaning with all the surfaces, floors, and all the equipment with bleach.
Okay.
And sanitizing.
Right. And that would include even things like the sound system, or that someone's touching the computer keys.
Yes.
Yeah.
And like these are the items that need to be cleaned several times a day, all the frequently touched surfaces.
Right.
Yeah.
Yeah, that's good. Yeah. Okay, I think we've covered the questions that I think we were hearing from. Is there anybody else who in the room today with another question? I know you've been firing them out in the chat section, but if you want to raise your hand using the Zoom features, yes, Ian first from Mount Martha. Unmute yourself and fire away, and then Paul Curtin after that.
Sorry? Yeah, different hat on today. I just want to check that I heard you correctly because the sound was a bit distorted. Are you proposing to produce a shorter version of what cleaning is required by tenants that we can give it to them? Is that what I heard?
A shorter version.
Well, I mean, if you go onto the health department website, for example, the amount of information that's there is just completely overwhelming.
Okay.
Just a feeling completely overwhelmed as it is.
Yeah.
So in the main, it's the wiping down the surfaces stuff. So if we were able to give our tenants something like that, get them to sign off at the end of every session that they've done it, and then get it to the church, scan it, drop it in the letterbox, whatever, so that we've got a record that they have told us that at the end of their gymnastics session, whatever it was, that they had done the cleaning as we had asked them to do.
Yes, I can do that.
That would be really
helpful.
helpful.
Be helpful. Yeah.
Okay. My other question relates to the comment which horrified me a bit about using bleach. I understood that you could use an ordinary dishwashing detergent because as long as it's a surfactant which breaks down fat, you're okay.
Yes,
And
you're correct.
Sorry?
You're correct. The virus is fat.
Yeah. So you can use normal dishwashing detergent in a damp cloth.
You can, but after that you would have to sanitize.
Sanitize what?
Sanitize the surface.
And so what does that involve?
The recommendation from the department is cleaning and then sanitizing.
So what does sanitizing involve? Is that bleach?
Well, bleach can be used for floors, yes.
Yep. How do you clean pianos and organs then? I don't want to put bleach or anything wet near an electronic instrument.
Okay. With a sanitizer and spraying with a protectant.
So what's an acceptable sanitizer? Glen 20?
Glen 20. A sanitizer would be 60 to 80% alcohol.
Yeah. Which Glen 20 is not, I don't think.
Yeah, that is their guidelines.
Okay, so we're looking forward to your new guidelines coming out next Tuesday, did you say?
I believe so.
Yeah, it's a bit of work to get that
depends
done.
on the comms team as well.
Right, comms team are working on that. Yeah, so I know they were trying to get it by today, but Tuesday is probably more realistic. So that would be really helpful to have a simple guideline that we can follow, but also our rental groups, when they start to operate, they can use as well. Yep, and to address the kinds of questions that Ian's asking. Paul Curtin.
Thanks, Duncan. I've got a question about soft chairs with soft surfaces, material surfaces, and should we put those away and only use the ones that are more easy to sanitise?
That's a frequently asked question, Paul. I'm hearing that quite a bit. How do we handle the soft pews?
Well, I'm not really familiar with all the too familiar with all the cleaning procedures. All I can say is I can send you the department's guidelines. But if you can do that, that would be good.
The big question is sanitizing. So yes, maybe that's something the crisis team could be aware of. That's actually a frequently asked question that's coming through quite a bit.
Okay.
Yeah.
I will ask.
Right. Have we got any other questions? Yes, Sue.
Our church has an op shop which we're very keen to reopen. We were talking about taking people's temperature as they come in and letting them enter through one door and exit through another. But we are concerned about whether we need to sanitise all the stock after people have been through.
That's a good question. Yes.
Sanitize all the stock. Do you mean donations or?
Yeah, the things we've got up for sale. If people come in and have a look at them, do we need to clean them before the next people come through?
I don't believe so. If you clean after each shift in the morning, that should be okay.
So it's just after a shift.
Make it easier for yourself, and ask people not to touch anything if they're not going to purchase it.
Okay.
Thank you.
The question around op shops is, I know that the Synod's encouraging us to discourage people over 70 to be involved in volunteer activities. So we do know that many people in their 70s run their own businesses and are active in the community. Is it a hard and fast rule or just a principle that we need to be protecting the vulnerable? Yes, do we need, for example, many op shop volunteers and workers are in their 70s?
I would discourage them from
okay, so that's
fighting.
That's discouragement rather than banning. Is that right?
We can't really ban anyone, can we?
Okay. Okay. So it's reminding ourselves of the principles of protecting people who may be at risk. Right. Here's another question, which is, can licenses be changed to include the price of cleaning or the fee for a bigger space? And I had to talk to Peter Thomas from Property Services about this one yesterday. And he is saying that there's no reason why we can't renegotiate with our tenants about the new, in fact, we do have to negotiate with them about the new requirements anyway. And there's no reason why we can't actually say, well, there's a change in the fee, the change in the rental agreement. So that's fair enough. Okay. Here we are, Kelly Skilton. I do believe that if there's an op shop that if people are trying items on, it would be encouraged to not put that back on the floor before it's able to be cleaned again. Okay, so, but often if you find the same principles that are being used in clothing stores, they're saying you're not able to actually go and try clothes on. You just have to take it as you see it, because they're finding the same principle. It's difficult for them to go through and do the deep cleaning process. Now, a question from, yes, and as Peter Byrne says, we discourage our clients from touching items as well. You touch it, you buy it, basically. Jill Ferrin.
You sanitize it.
Yeah, that's right. Now, Jill.
Yes, I just wanted to clarify the statement about reporting. being the safe church person at Southern Peninsula, there was a little bit of blurring of the sound. Elvira said report it to Synod. Do we not have responsibility to report a case to DHHS or the police or whoever, the health department?
Okay, this would be the same procedure as reporting any other incident. Usually I believe they go through to the Synod. And if there are a notifiable incident, then the Synod reported to WorkSafe. And in this case, it would be, again, going through Synod and then through to me, and I can report it to the department.
Okay. And Elnura, you have a risk register, is that right? You keep a risk register of any cases that are coming up that we need to be aware of as a Synod, which would include these kinds of cases?
Yes.
Well, and what happens if the case crops up in the weekend?
In the weekend?
Well, you're presumably not there 24/7.
No, I am not, but you can still report it to me. I always respond to my emails, even on weekends.
Okay.
Well, I suppose my question is, it's fairly urgent if a case is reported to us. It seems that's a sort of a bit of a delaying thing.
It needs to be a confirmed case.
So they would have to be have been tested positive for that to be in that situation. Okay. But we can encourage people to go to the doctor and to go and get tested. Those are the things that we can do. Yes. Now, Sam has a question.
I think more of a statement around reporting incidents is that the department has a very clear guideline as to what needs to be reported and in what time frame. So if we reported through to Elnura, she'd be able to determine the urgency of that reporting, and we could follow our procedures and perhaps enforce an isolation period until we knew the outcome of that report. So if someone appeared to be showing symptoms of COVID-19, we would send them to the doctor. We would report that to Synod via the risk forms. We would perhaps ask for isolation procedures to happen for a short period of time until we knew the outcome of that report. So keep everyone safe around that incident, but do the right thing by reporting it through to Synod. Is that right, Elnura?
That's right. That's right. You forgot.
Thank you.
Okay. Well, it's good having you there, Elnura, to keep an eye on these things. Are there any other questions? Lorraine.
Hi, I'm Lorraine. I'm the safety officer at Ormond United Church. We have been doing a bit of work on this already because I'm actually working in an education facility that has got a risk management implemented also. So with regard to the cleaning and worrying about losing bleach, there are some eco-friendly products that you can use, and that is correct. If you do wipe it down with the just the soap and water, you do have to then sanitize. So yeah, there is one of the thing that we use at our kindergarten is Tri-Nations, which are all eco-friendly. They have products that you know, you can water down, and they're also very good, which you have to be mindful for, is that they're very good with allergies as well. So people do have allergies, so if you're spraying, you know, things that might affect people's allergies. So yeah, that's just something, food for thought. With regard to if there is an incident, there are guidelines around that as well, but I'm not going to take up time going through them here, but I'm happy to pass those on to anyone that may want to read them. But I guess it's very difficult for everyone because it's written in such terms where it's not simple, and we're all simple people that want things, you know, clear. So yeah, we've decided to sort of kind of modify things that fit our own place too. So I think that's important as well. So yeah, just a few sort of points.
Yeah, that's great, Lorraine. Thank you. And Lorraine Ediston at Ormond, if you want to touch base with Lorraine to hear more about those products, yes. Elnura?
Yes, I would be a little bit careful about using products that are not recommended by the department in case anything goes wrong. We are not following what their recommendations are. Same as using hand sanitizer, for example. They're recommending 60 to 80% alcohol, and if we go ahead and use something else,
Okay. So I see.
We could be held.
Right. And David Morgan's put a link in our chat space to the DHHS guidelines for cleaning and disinfecting. Yeah.
Yeah, that's the document I was talking about earlier.
That's right. Yeah.
Yeah.
Okay. So that's helpful. Now, James Franklin.
Yes, it's the use of Bibles and hymn books during a service, and should they be continued to be used or taken out, and also for choirs and singing?
Okay, well, I could answer that first one, which is we should avoid having anything in the pews, or we can remove our Bibles and hymn books. That's a very quick way to reduce a lot of risk. That's for sure. Yeah. And then the second part of that question was that around singing?
Yes.
Okay, and yes, that's a tricky one because at the moment the science is still not established. There's no peer-reviewed articles or journal articles or research projects that have been finalised around the fine droplets that hang around in the air when we sing, as opposed to sneezing, which has large droplets that go to the floor fairly quickly. When we sing, the fine droplets actually float around the room for sometimes 20 minutes to an hour. And we can mitigate against that by having windows open and having a breeze, making sure that the air is refreshed as opposed to just air conditioning. But some churches, some denominations are saying to their congregations, in the meantime, just hold off on the singing. So the advice from our synod is no advice at this point. We're still following that through. Is that right, Elnura?
That's right.
Yeah.
Yeah.
So it's a matter of actually being aware of the potential risk, and that is also the context in which we're meeting. So in a small room, it would make sense with no ventilation. It would be madness to have a choir or a singing group singing. Larger buildings, less risk, but we still have to manage that risk. So I know some congregations have said we'll find other ways of using music in the meantime if and when they meet. I know one congregation told me that singing is essential for their way of being, and if they come together to worship and they don't sing, it wouldn't be worth it. So I'm just not going to meet until it's possible for that to happen. Yeah. Alrighty, any other questions? Ian, another one, yes?
Oh, it's not a question so much, Duncan. It's an observation of what you just said about leaving the doors and windows open to let the breeze blow through. Down our part of the world, the breeze blows in off the bay in the middle of winter, it's bloody freezing. And so we would run the risk of our people dying, perhaps from pneumonia, more so from the risk of COVID-19. So it's a real challenge to get the balance right, is probably the point I'm making.
Yes, that's right. So that's why community choirs are not opening up. Most community, in fact, the Choir Association of Australia, I saw recently, they have Community Choir Association are not opening up at all until this is all sorted out. We just cannot afford to be the epicenter of a new outbreak because we had singing in our congregations or because we had a choir meeting there. Okay, any other comments or questions? Was it Ray? Did you have and then Peter? Ray McCluskey?
I would just come back to the earlier question that I asked to you, Duncan, through you, Duncan, about deep cleaning. Obviously, congregations at various levels will have the ability to undertake cleaning. Some won't. Some may need to ask for contractors to come in. And the question I have for Elnura to take to the Crisis Committee is, will Synod help fund congregations to undertake deep cleaning if there is an outbreak?
Yep, okay. I will ask that question. If there is an outbreak?
Yes, if there is an outbreak. Not for normal cleaning, Elnura, but just
okay.
Really if there's a COVID case, would the Synod be open to assisting congregations with the cost of getting professional people to come in and deep clean?
Okay. Yep.
Thank you.
No problem.
Really helpful. Yeah. And I saw somebody else had a question. Yeah, Peter, that's right, yes.
This may seem fairly obvious, but should a congregation wish to hold a service, I'm not sure whether the issue of Holy Communion has been dealt with in this meeting. I arrived a little late, but I doubt that it's been. I haven't heard anyway. I would have thought that that would be something probably to be avoided at the moment. Would that be correct?
Yes, that's a good question. Communion and baptism. And at the moment, we've said no baptisms. And that was even earlier than Easter. Back in March when we were just starting to put some restrictions in. And communion, we were saying it needs to be done very carefully back then. But I would suggest that, yes, it would be make a lot of sense not to have a communion service at this point. The only setting in which you might be able to think about that would be where you are using the pre-packaged communion packs, where each person has a wafer and a disposable little cup to themselves that they open, and it's not handed to them. They actually pick it up themselves as they come in. That's the only setting in which that might be possible at this time, I would think. Elnura, do you want to?
Is that? I believe that's covered in the frequently asked questions that come out every Thursday.
Do you know what? Do you remember what they said on that one?
That is an Isabel question.
Okay.
Really.
Sorry, I haven't been.
I'll have a look at that.
Been accessing those because I haven't been on the list.
Yeah, the frequently asked questions are on the Victoria Tasmania website, and they're updated every week. Just see if we can find the. Okay, Holy Communion. The only element in there is remote communion. So we're able to have celebration of Holy Communion as part of services for people who are in dispersed places. So there's no green light at this point for having communion in person in our worship services. Does that make sense, Peter?
Yeah, thanks very much for that. I'll have a look at those details as well. I wasn't aware that it was there.
Yep. And I've been sending out the Victoria frequently asked questions document every couple of weeks to all office bearers, chairs, secretaries and treasurers, just in case you haven't been able to go and have a look at the website. Alrighty, so any other questions or comments? We've got 6 minutes left before we finish up for the day.
Everyone's on mute.
Yeah, that's right. So we just have to put your hand up if you're James Franklin again.
Yes. With the licensing agreements, you mentioned that they should be amended. Are the property people at Synod doing anything about amending the document, or do we just make our own amendments?
This is for your rental agreements or licenses.
Licensing agreements,
yes,
for tenants.
Yes, I did raise that with Peter Thomas yesterday, and I don't think Property Services had even thought about it. So they're going to get onto that now. They're going to provide some advice that would be helpful for us to make any amendments or separate agreements or changes to costs and so on.
Or should we wait until they have come forward with their agreements?
What I would suggest is that you actually start working now on any changes that you need to make. And our Synod, Presbytery Property Committee and Synod Property Services, they'll be doing some work behind the scenes to make sure we have good processes that will help us. But in the meantime, we do need to start preparing your local arrangements. Now, Nigel McBrien has another question. And there you go, Nigel.
Hi, it's a question or more a community question. During the week, I discovered that the men's shed had been meeting. This is a community men's shed, and all the members that go to that are 70 plus. And so the question was, why can't we meet when they're meeting at 70 plus? And no, I know some other groups are the same. They're 70-year-old and over. And it was just more of an interesting question from the, I know that we're not meeting at 70 and over, but what we think about that.
When our congregational members see what's going on in the community, and some groups are meeting with senior groups like the men's shed. And so the question, I guess, for us is, do we take our lead from those kinds of groups, or do we actually provide leadership in our community, saying this is our priority around the safety of our members and our community members? I think that's
okay. Just to throw another part into that the person who goes to the men's shed is one of our church members.
Right.
So
it's
Duncan.
Yes, Alan.
Men's Shed Australia have got a very comprehensive policy. We've got the Men's Shed at Leemore, and they've gone through a whole process of what they can do and what they can't do, and we're working with them to see it. So go back to the Men's Shed Australia and they'll give you all the details of what they're doing.
Right. Yes. So, and I know Leemore, it was, you're not having the Men's Shed operating there, is that right?
No, they're I think it's Monday they're starting, and there's only going to be a tool swap. There'll be 2 people on duty, and only 1 person at a time will come in, hand in a tool and take another tool if they want it. So that's the only activity for next week at this stage.
Okay. All right, that's helpful. So they've weighed up risks and they've come up with a plan to operate.
And they're following it, but they're negotiating with us, and we're understanding completely what they can do, and we're modifying anything if we don't agree with.
Yes. So, and once again, to reiterate that each organisation has to manage its own understanding of risk. And
that's the comment from Peter.
Yes.
Peter,
that's very helpful.
Yeah.
I'll put my hand up as a lawyer.
Yep, we've lost you there, Peter. Yeah, so say that again.
I was just going to say that every organisation obviously has a duty of care to uphold, and the standard of care is what a reasonable organisation would do in the circumstances. So as long as we're exercising our duties under that understanding that what we have to do is reasonable in the circumstances, and obviously the circumstances are pretty bleak if someone actually gets the virus and becomes a hotspot or something. As long as we're aware of that and comply with our duties, then we can't be criticised.
Yeah,
that's true.
That's a great comment.
Yes. So it comes down to the principles of risk management for us as the Uniting Church, that we have to understand the risks for our members and other people. We actually have to take adequate steps to understand what's going on in our context and mitigate the risks, do something about them. And not only that, but also to monitor those risks, those plans, so that we are sure that even though we have a plan, it is actually being put into place. People are doing what we agreed to do. And that applies to our own members as well as the organisations or individuals who might rent our properties. So that's, I guess, a summary of what we've been talking about today. And it's been great having you here, Elnura.
Thanks.
We've put you through the ropes, yes.
Able to help.
Yes, and it's great knowing that you're part of the crisis team and you're hearing our frequently asked questions and able to feedback that in. And we look forward to the new resource you're bringing out next week. It'll be great.
Thank you.
All right, well, thank you very much, everybody, for taking part today. And as I said before, we'll have this session that's recorded, and we will be putting this on the YouTube channel for us to watch later on. And you're able to share that with your members, your Safe Church contacts, people who are looking after different parts of the program, so that we're able to understand our responsibility as congregations of the Uniting Church in Australia. So thank you, everybody, and we look forward to catching up again. All the best for the weekend to come, and all the best for the process of discernment that each congregation is going through as you work out what you can reasonably and feasibly do and sustain. There's no pressure on anyone to move quickly. We're able to take our time and do things well, so that at the right time we're able to resume some of our activities and look after our members. Okay, all the best. God's strength to you, everybody.
All right.